interventions, all right, we should always have some nitroglycerin on our table. Nitroglycerin, we've already talked about, works on spasm, coronary artery spasm, okay? So we actually will administer this at times right into the coronary artery. Now, it also will help, it's a vasodilator. So even if it didn't spasm, but say we're going to do our intervention and the doctor's looking at the vessels and they're like, well, they don't look that big. I want to give them some nitro before we start, because what if it looks like it's a 3-0, but it may have some vasoconstriction going on. It may truly be a 3-2-5. All right, so let's give it some nitro. Let's vasodilate so we can see the true size, because especially if I'm going to implant a stent in it, I don't want to undersize the stent. I don't want to have too small of a stent. I want to make sure I have a good size stent. So sometimes they'll actually give intracoronary nitro before they start treating the lesion. Now, one of the things we have to worry about with intracoronary nitro, remember nitroglycerin, what can it do to blood pressure? This is from pharmacology last. Kaylee gave you a hint. Anybody tell me? What's it make go down? Blood pressure. So we can make the blood pressure go down. So if they already have a low blood pressure, we have to be careful with giving them nitroglycerin. Okay? Now, nitroglycerin comes, now this one doesn't say the strength, they have, you write the strength on here, but I do have my little, this is going to be hard. You might want to zoom in on this. So the way that we administer, or we like to administer, is 100 micrograms per milliliter. So remember how heparin is units per milliliter or cc. Well, nitro concentration is micrograms, okay? Sometimes it comes in the bottle, so it comes in a big bottle most of the time. And we have to draw it out and they have to pass it off to our tray in a sterile manner. Sometimes it comes 100 micrograms per cc. Sometimes it comes double concentrated. So it's 200 micrograms per cc. If it is that situation, the nurse is going to tell us what is the concentration, and they're going to give us some in our little cup. Now, usually, because what we're going to have to do is dilute it. Because it's too hard to remember, okay, if it's 200 per cc, that means if I want it 100 per cc, I only give half a cc. It's easier to give one whole cc. So what we do is say the nurse has given us 5, so they've passed it off into our little cup, and they tell us, okay, this is 200 micrograms per cc, and I gave you 5 cc's. What we need to do is dilute it with some of our saline, heparinized saline. So I'm gonna just get 5 cc's of saline and dilute it, okay? Because we usually want to have about 10 cc's on our tray for our interventional procedure, okay? And what we'll do, doctors like us to go ahead and draw up in our syringe. Now for radial, and we're going to talk more about radials tomorrow, we're going to do the same thing because we give nitroglycerin. We're always going to have nitroglycerin or some kind of a cocktail on our tray for radial artery spasm, okay? But I'm going to actually have this drawn up, ready to go for my interventional procedure. We can almost say this is another accessory. It's pretty important, actually. Now, you will get to know your doctors, how they like things. Some docs like you to use 3 cc syringes. A lot of times when they give a dosage, they give anywhere from 200 to 300 micrograms at a time for the coronary artery spasm or to vasodilate. So in this situation, if I know my doctor likes it in 3s, I'll draw up 3 syringes to have ready, and all would be labeled can actually have it over here so the doctor can get it and administer it at any point in time that they want to. Now, and I'm really talking to you because this doesn't matter so much for them. It really, truly is even getting deeper. So, nitroglycerin, but I won't just talk to her. Nitroglycerin vasodilates your larger vessels. Remember, we've talked about this. But at the capillary bed level, down in the very, very small capillary beds, it doesn't work well for vasodilating. Adenosine or verapamil, those are medications that work well on the capillary beds, okay? Now, so if you're in a situation where the doctor thinks that maybe some microparticles have gone down and they're clogging up that microcirculature, what you're gonna see is not very good filling of that coronary artery. Call it no reflow. It's because those tiny little capillaries are getting clogged up. If they give adenosine or verapamil, and that's usually a doctor's choice, what it can do is kind of open up that capillary bed, and hopefully those little particles will flush on through, and then we're gonna get good blood flow again. This can happen in acute MIs where there's a lot of clot, and we're trying to treat it, and we knock off some of those little pieces of clot. Vein grafts. So vein grafts, the material that clogs up vein grafts is a little different. And we kind of say it's kind of like cottage cheesy. Okay, and so sometimes when you go in and you're working on a vein graft, you'll knock little particles loose. And so a lot of doctors will actually have you have adenosine on the table ready to go or verapamil on the table. And so if the doctor told me I want adenosine and now all my cups are used because I need this for something else I'm going to show you in just a minute, I might just get one of my little bowls, label it as adenosine, and the nurse will mix up the adenosine and bring it over and put it in my bowl. Then I'll get my syringe, whichever syringe I decide I'm going to do my adenosine. There's nothing in that. Anyway, it doesn't really matter what medication you're using or whatever, you want to make sure that you label it. That'll be for my adenosine syringe, my adenosine. Now adenosine comes 10 micrograms per cc. So it's a little bit different. The nurse will mix that up for us. They actually have to mix it. Doesn't come already in the concentration that the doctors like to deliver it for this situation that we're going to use. Verapamil, verapamil, and I'm not going to make you memorize this, but I want you thinking about this. Its concentration is 300 micrograms per milliliter. Okay? I've seen doctors give upwards of 1,000, 10 at a time, 50, 1,000 total micrograms of adenosine in situations. They usually do give 100, or they may give like 50 at a time, because it's 10 micrograms per cc. Anyway, that one is a little bit deeper. I want you to be more concerned right now with your understanding that nitro is probably what you're going to see the most on your tray for your intervention. Yeah. Okay? Now, let's look at our inflation devices.